How do MAOIs cause hypertensive crisis via drug interactions? Have you ever wondered how certain medications can lead to a sudden spike in blood pressure? Today, we will discuss how monoamine oxidase inhibitors, known as MAOIs, can trigger a hypertensive crisis through drug interactions. This is an important topic, especially for those who may be taking these medications. MAOIs work by blocking the action of an enzyme called monoamine oxidase. This enzyme is responsible for breaking down neurotransmitters like norepinephrine, serotonin, and dopamine. It also helps to metabolize dietary amines such as tyramine. When someone takes MAOIs, the breakdown of tyramine is inhibited, leading to its accumulation in the bloodstream. Now, why is this a problem? When tyramine levels rise, it causes the releases of large amounts of norepinephrine. This neurotransmitter activates receptors on blood vessels, leading to vasoconstriction, which is the narrowing of blood vessels. As a result, blood pressure can rise rapidly and dangerously. Certain foods and medications can worsen this situation. Foods rich in tyramine, like aged cheeses, certain wines, and pickled fish, can trigger a hypertensive crisis when consumed by someone on MAOIs. Normally, the enzyme in the gut and liver breaks down tyramine, but MAOIs prevent this, allowing tyramine to build up. Additionally, some over-the-counter medications, especially decongestants, can also lead to issues. Sympathomimetic drugs like ephedrine and pseudoephedrine increase norepinephrine activity, which can further elevate blood pressure when taken with MAOIs. Other drugs such as L-Dopa, methylphenidate, dextroamphetamine, reserpine, guanethidine, and tetrabenazine can also interact with MAOIs and lead to dangerously high blood pressure. When a hypertensive crisis occurs, it is defined by a systolic blood pressure above 180 millimeters of mercury or a diastolic blood pressure above 120 millimeters of mercury. Symptoms can include severe headache, palpitations, neck stiffness, nausea, vomiting, sweating, dilated pupils, and chest pain. If not treated promptly, this condition can lead to serious complications like stroke or organ damage. To prevent these crises, patients taking MAOIs must avoid tyramine-rich foods and be cautious with certain medications. Regular blood pressure monitoring is essential, especially if symptoms arise. If a hypertensive crisis does occur, immediate medical treatment with short-acting antihypertensive agents is necessary to lower blood pressure safely. In summary, MAOIs can lead to hypertensive crises through interactions that cause excessive norepinephrine releases. Awareness of these interactions and careful management is vital to avoid life-threatening situations.